wondering if you might be pregnant but haven't even missed your period yet? Well, for many women, the body actually gives several early clues, sometimes even before a pregnancy test can confirm anything. You just need to know what to look for. Here on this channel, we talk about pregnancy, women's health, babies, and the journey of becoming a mom, so make sure to subscribe. And while you're at it, let me know in the comments, are you already pregnant or just hoping that you might be? Number 1, fatigue. Imagine this. You wake up in the morning after what seemed like a perfectly good night's sleep, you take a shower, get dressed, brush your teeth, and somehow you already feel like you could go right back to bed. Feeling tired can happen to anyone at any time, which is why it's easy to overlook as an early pregnancy symptom. But once you become pregnant, your body experiences a surge in a hormone called progesterone. You can think of progesterone as the pregnancy protector. It helps maintain the lining of the uterus so the baby can grow safely. But it also has another effect. It acts like a natural sedative, which can leave you feeling unusually tired. On top of that, your body is beginning to redirect a lot of its energy toward building the placenta, the organ that will support your baby throughout the next 9 months. So if you're feeling completely drained, it actually makes perfect sense. Number 2, breast tenderness. For some women, it's just a mild sensitivity, but for others, even your most comfortable bra can suddenly feel unbearable. Hormones like estrogen and progesterone are already beginning to change your breast tissue. Your body is preparing the breasts to eventually produce milk, and that process can make them feel swollen, tingly, and extremely sensitive. As pregnancy progresses, you may also notice the skin around your nipples, called the areola, starting to get a little darker. This change actually helps newborn babies find their food source more easily after birth. But here's the tricky part. Breast tenderness can also happen right before your period. That's one of the reasons many women overlook it as a possible early sign of pregnancy. Now, before we move any further, let's talk about timing, because this is the part that confuses almost everyone. Believe it or not, pregnancy weeks are counted before you're technically even pregnant. Let me explain. If we look at a typical 28-day menstrual cycle, which is the average for many women, week 1 actually begins on the first day of your last period. About 2 weeks later, ovulation happens. That's when the ovary releases an egg. If sperm are already waiting in the fallopian tube or arrive shortly after, the egg can be fertilized within about 24 hours. After that, the fertilized egg begins dividing into many cells as it slowly travels down the fallopian tube, and this journey usually takes about 5 to 7 days until the tiny cluster of cells finally reaches the uterus and implants into the uterine lining. That moment, implantation, is when you are officially pregnant. Once the embryo implants, some of its cells begin producing a hormone called HCG. That hormone sends a signal to the ovaries telling them to start doing a few very important things. Number 1, don't start a period. HCG sends a signal to the ovaries saying, don't start a period, instead keep progesterone and estrogen levels high and continue supporting the growing pregnancy. Once HCG rises enough, we can detect it in the blood, usually about 2 to 3 days after implantation. A urine pregnancy test will typically turn positive a few days later, right around the time you would normally expect your period to begin. So if your period doesn't show up, that's a good time to take a pregnancy test. Some early detection pregnancy tests can even show a positive result before you've officially missed your period. Speaking of symptoms, symptom number 3 is a wild one: food aversions. This is when you suddenly cannot stand foods you used to love. So why does this happen? One common theory is that pregnancy hormones turn your sense of smell into something like a superpower. Your brain may be trying to protect the baby from anything that might have even the smallest chance of being harmful, even if the food is actually perfectly safe. But here's the twist. While some foods suddenly become unbearable, you might also start craving the strangest combinations. pickles and ice cream, hot Cheetos dipped in yogurt? Pregnancy cravings can get creative. Number 4, the emotional roller coaster. We're talking about serious mood swings. One minute you're laughing at a cheesy meme, the next minute you're crying over a paper towel commercial. You feel calm, and then suddenly your brain decides, let's have a panic attack. You're not being dramatic, you're pregnant. Your hormones are rising quickly. Great for supporting your pregnancy and your baby, not so great for your mascara. Number 5, cramping. This one can be confusing because it can feel exactly like your period is about to start. Some women experience the same dull aches they normally feel before or during their period, low in the abdomen or sometimes in the lower back. But instead of the uterus preparing to shed its lining like it does during a period, it's actually doing the opposite. It's stretching and growing to support the pregnancy, and that can cause mild cramps. So if you feel those familiar cramps, but your period never arrives, it might be your body sending an early signal that you're pregnant. Number 6, light spotting. This is another symptom that can easily cause confusion. When the fertilized egg implants into the uterine lining, it's essentially tapping into the uterus's blood supply. As this happens, it can cause a small amount of bleeding. This is called implantation bleeding. It's usually very light and often appears earlier than when you would normally expect your period to begin. But if you know what to look for, that early spotting might help you realize it's not a period at all. It might be implantation bleeding, and that could mean you're pregnant. Number 7, needing to pee more often, but when you go to the bathroom, not much actually comes out. This happens because your body starts sending more blood through the kidneys during early pregnancy, which means you produce more urine. Your bladder itself hasn't changed size, so it fills up faster. On top of that, early pregnancy hormones can make the bladder area more sensitive, which means you may feel the urge to go even when there isn't much urine there yet. Now you might be wondering, wait, what about morning sickness? Isn't that one of the earliest pregnancy symptoms? Most women do experience some nausea during pregnancy, but for many, it doesn't start immediately. Morning sickness often begins a few weeks after conception, around 6 weeks into pregnancy, when pregnancy hormone levels really start to climb, so it usually appears a little later than the early symptoms we just talked about. Now, if you're starting to check off a few of these symptoms, especially if your period is late or completely missed, your body might be quietly hinting at some very big news. But don't worry if you're not completely sure yet. Sometimes it just takes a little more time for that quiet whisper to turn into a very clear answer. Here's something really important to remember. Every woman's body is different. Some women experience almost every symptom on this list, while others may feel almost nothing at all, and both situations can still lead to a perfectly healthy pregnancy. Your body tells its own story during pregnancy. So if you think you might be pregnant and you're noticing some of these early signs, the best next step is to take a pregnancy test, especially if you've already missed a period.
Thank you for watching.